In this video we will focus on the anatomy of the female internal reproductive organ and the monthly transport of the oocyte in the fallopian tube. As the ovaries and the fallopian tubes are entirely covered with peritoneum and thereby not firmly attached to the body wall, these structures can easily twist when, for instance, the size of the ovary increases. Twisting of the fallopian tubes can also be the result of an hampered transport of the fertilized oocyte with subsequent implantation, the so-called extrauterine pregnancy. About 1–2% of live birth is an extrauterine pregnancy, which often coincides with symptoms such as sharp abdominal pain, vaginal and/or abdominal bleeding. Knowing the anatomy of the female reproductive organs, you will be able to reason why it can be a life-threatening situation for a pregnant woman. Let's have a look at the schematic figure of the female reproductive organ. It consists of a vagina, a uterus with a left and a right uterine tube, also called the fallopian tubes. They transport the oocyte from the ovary towards the internal cavity of the uterus. The uterus, ovaries and the fallopian tubes are all covered with a thin layer of peritoneum, and each month an oocyte matures in an ovarian follicle. After expulsion from the follicle and a breakthrough through the covering peritoneum, the oocyte is picked up by the distal end of the fallopian tube at the same site. This wide entrance part of the tube is called the infundibulum and consists of many fimbriae. The travel through the intraperitoneal cavity is very short, as the infundibulum moves over the ovary precisely to the place where the ovulation process occurs. The epithelial cells in both the infundibulum and the adjacent ampulla contain many cilia. These motile cilia are essential to transport the oocyte towards the uterus. Recently, it has been discovered that the smooth muscle cells within the wall of the tube have a peristaltic activity and support the oocyte transport as well. The journey towards the uterine cavity takes approximately 5 days after ovulation. Fertilization of the oocyte by a sperm cell has to occur in this time frame. During its journey, a fertilized oocyte, also called the zygote, starts to develop. The zygote cannot attach to the epithelium of the ovarian tube as it is covered by a protecting membrane. 7 days after fertilization, the oocyte is already in the uterine cavity. It will hatch from its surrounding membrane and attach to the epithelium, followed by an active migration into the subjacent layers. This process is called implantation. Normally, the processes of transport and implantation of the zygote are precisely regulated and tuned. If the transport process is hampered, the ovarian tube will be the site of implantation. Implantation outside the uterine cavity is called an extrauterine pregnancy. In this clinical case, an embryo is implanted in the fallopian tube, which you can see as a small swelling shining through the thin walled tube. Further growth of the embryo can cause rupture of the tube and nearby ovarian artery, as we can see in the next figure. Bleeding in this area can be very dangerous, as large amounts of blood flow into the high volume peritoneal cavity. The growing embryo can also twist the fallopian tube, through which the blood supply can be hampered or even stopped, resulting in a very painful ischemic ovary and tube. If a doctor suspects a rupture of the fallopian tube, emergency surgery is necessary to stop the bleeding. In some cases, a damaged tube and/or an ovary may have to be surgically removed. If the pregnancy has not progressed too far, the embryo can be removed laparoscopically, and the damage to the tube can be repaired. In this video we have looked at the anatomy of the internal female reproductive organ, the monthly transport of the oocyte through the fallopian tube, and the consequences of an hampered transport of a fertilized oocyte. And with this knowledge in mind, I invite you to think in more depth on the following questions. What are the predilection sites of an extrauterine gravity in the fallopian tube? Can you indicate other sites of ectopic implantation of an embryo? And if the ovary has to be removed, which blood vessels have to be ligated and why? I look forward to seeing your discussions about these questions in the forum.